Today we're going to be talking about the magic hug adjustment. I don't know if you've seen this before, but basically what happens is a chiropractor kind of climbs on top of the table, puts their arms and hugs someone's head, and then just pulls really hard. All right, it's Dr. DeCubellis here. Make sure before I go any further, you like and subscribe to the channel below. I'm going to be talking about a lot of different things, especially chiropractic, giving you my takes, especially like I'm going to do today. So you don't want to miss any of that. So make sure you like and subscribe below. Today, we're going to be talking about the magic hug adjustment. I don't know if you've seen this before, but basically what happens is a chiropractor kind of climbs on top of the table, puts their arms and hugs someone's head, and then just pulls really hard. Now, I think you can probably get the gist of how I'm explaining this, that this is not something I'm a fan of. If you watch any of my other videos, you know that when I talk about adjusting, I like to be very specific. I like to know what segment we're working on, why we're working on it, and what's the underlying issue that we need to be resolved. With something like this, when you're just putting your arms over their head, you're not even contacting their spine. You're literally contacting the base of their head and just pulling up. We don't know what we're adjusting. Yeah, you hear some cavitation or some noise, but I would argue that there's no way that that chiropractor can tell you what segment he adjusted or how many segments he adjusted, because you can't always just go by how many sounds you hear. There's no way you can do that. So my argument would then be, because you don't know what you're adjusting, how do you know that your adjustment was even warranted? How do you know that this is going to be needed for whatever outcome? How does this fall into your treatment plan? And you really can't answer those questions because you don't know what you just did. That's the reason why I have problems with adjustments like this, Y strap, anything to where it's just we're adjusting kind of everything and anything all at once. The rationale behind that doesn't make sense to me. You can't really back up the reason why you would do that adjustment over something else unless you're just like, well, I don't know what else to do, or I can adjust everything at once. And then we start to say, okay, well, is that the safest thing you could have done for the patient? And there really isn't an argument to say that, yes, that's safer than another technique. And it warranted that type of technique over something else. So not a big fan. Lots of risk factors here. Don't know if the doctors are doing proper exams to make sure there isn't any underlying issues that type of adjustment is not going to be, not going to be the safest that it could be. But there's a lot of precautions. We have to make sure, especially with a thrust like that there isn't any underlying arthritis or degeneration. There isn't any underlying nerve issues, irritation, disc issues. I don't know how thorough an exam they did, so I can't comment on that. However, I will say that when we look at any kind of treatment, no matter what it is, whether it's a chiropractic adjustment, physical therapy, it's a pain pill, whatever it might be, the question we always have to ask ourselves is, A, does this treatment make sense for what the problem is and where we're ultimately wanting to go? And B, is this treatment the safest type of treatment we can get with the least amount of potential side effects? When we ask those questions and answer it in this case, I don't like the magic hug. There's other things that can be done. Doesn't seem to check those boxes, so I'm not a big fan. So again, I'm Dr. DeCubellis. Again, make sure to like and subscribe below. Hope you like this video. I'm going to be putting more content just like this, discussing other things we see in the chiropractic profession, because it's all over. It's all over. You see videos all over, and I want to make sure you're getting a real take of a doctor who's actually practicing, and so you get an idea of what we're really discussing behind the scenes about these types of things, and you understand what's really going on, and more importantly, the questions you should be asking any doctor before they do these types of treatments.